A report by Singapore's largest national healthcare operator has projected that the proportion of stroke patients under its care could double by the year 2050 if the situation is left unchecked. The National Healthcare Group, which derived data from its patients in the central and northern parts of Singapore, highlighted it as an example of the rise of chronic conditions here. Now, the group will use the data to drive its strategy, enabling it to provide more customized services. Cheryl Goh reports.
The National Healthcare Group expects its number of stroke patients to increase by close to 110% by 2050. The number of diabetes cases, another chronic condition, is projected to rise by 87% by the same period. NHG says poor lifestyle habits such as unhealthy diet, lack of exercise, stress and smoking could reduce a person's lifespan by as much as 12 years. It also has the most damaging impact on the healthcare system in the long term because it worsens issues like frailty and chronic disease. Now, this challenge cannot be tackled by the healthcare system alone, but requires a whole-of-nation approach to change mindsets.
Chronic disease management is one of the major issues we've been looking at, how to ensure that they are well controlled. So increasingly we are developing programs whereby we want to monitor them closely and make sure that their disease control, their blood pressure levels, their sugar controls, lipid controls are well coordinated in the community.
NHG says it has seen the number of patients with chronic conditions at its polyclinics increase by about 56% from 2008 to 2017. It looks after people in the central zone, such as Ang Mo Kio, Serangoon and Kallang, and it's anchored by Tan Tock Seng Hospital, serving 1.4 million residents. NHG also serves the 800,000 residents of the Woodlands and Yishun zones. The central area also has more seniors. 17% of residents are aged above 65. The national average is 13%.
We are actually being very targeted in each of the respective zones. So in Central, for example, where Tan Tock Seng is, the population is slightly older. The emphasis is really on taking care of them in the age of frailty. In the north, the populations are slightly younger, and we focus a lot more on the preventative and the chronic disease management.
This includes exploring transformative new models of care, such as a needs-based approach that is tailored to the specific requirements of the local community.